We also analyzed our data to look at safety outcomes in patients with elderly patients treated with axi-cel. In the ZUMA-1 study, outcomes in efficacy has been reported in elderly patients above the age of 65 versus below the age of 65. And we found that the efficacy-wise, there was no difference between the elderly and the younger population. But now we looked at safety outcomes. We looked at a total of about 72 patients treated at our institution at MD Anderson, of which 20 were above the age of 65 and 52 were below the age of 65. And we found that the efficacy was comparable to what was previously reported in the ZUMA-1. But in addition, we also found that the safety also was very comparable, both with respect to the incidence and severity of the CRS, as well as the incidence and severity of the neurological toxicity. Moreover, we found that the hospitalization period was identical in both groups of patients. In fact, the median hospitalization was about 16 days in each group. And also, the ICU admission rates were also comparable. There was about a third of the patients required ICU admission, and the median ICU admission stay was about 3 to 4 days in both groups. So it looks like both safety as well as efficacy seems to be comparable in the elderly patients and the younger age population. And the oldest patient that we treated at our center was 83 years old.